It's just about 35 minutes after the hour of 7 o'clock on this Monday morning, and you're on the Now Morning Show. My name is Kimberly D'Souza. Now, gender-based violence, in particular violence against women and girls, is one of the most widespread, persistent, and devastating human rights violations. Now, as we continue the discussion on the issue, we look at the creation of the Regional Essential Services Package, that's the ESP, Community of Practice. And here to tell us more about this is the Director of the Unfpa Sub-Regional Office in the Caribbean, Ms. Alison Drayton, and the Deputy Program Manager, Gender and Development, Caracom Secretariat, Ms. Anne-Marie Williams. Ladies, good morning. Thank you so much for joining us on Now.
Good morning. And thank you for having us.
Now, Ms. Drayton, I guess I will begin with you first. I mean, what is the ESP COP?
So, as you mentioned, the Essential Service Package, the Community of Practice, is an initiative that brings together professionals in the areas of justice, health, social services, education, to look at how we come together to deal with gender-based violence. We are launching the Community of Practice tomorrow and Wednesday, and the aim is to have a regional roadmap worked at with the key regional institutions, Caracom Secretariat for sure, in how we deal with this together. And if I can just say, you know, moving from what your previous guest said, that point of the entry point when someone picks up the phone and calls, it is very important that across all of the sectors dealing with it, that we have kind of a coordinated, seamless approach so that you get the same advice, what we call referral pathways, and kind of move forward seamlessly. Anne-Marie, who's a gender expert, can also.
Of course, Ms. Williams, come in.
You're so right. So it's really to look at the standards and the priorities that each member state will have in the region to ensure that survivors of gender-based violence, which is a subset, survivors of domestic violence, which is a subset of gender-based violence, will be cared for. So the package is actually a standard. It's really a tool to look at how member states will prioritize what is important for survivors in their area, because there's not a one size that fits all. So some countries may be already doing some things, some may have to add different types of services, but it's to ensure that we bring survivors of gender-based violence to a better place.
Now, why is this being launched now? How is it so important to be launched at this particular time? And anyone can address this issue.
Well, it's something that has been in the making for a couple of years now. Under the Spotlight Initiative, we did, when I said we, UNFPA and the Caracom Secretariat launched an inception training last year in November virtually. So we bring all of the key players together. And we've done the training, we've looked at terms of reference, and so now we're at a point whereby we could bring the stakeholders together in the first face-to-face meeting since COVID has eased a bit, to ensure that we speak to each other, we network, so that we can put together this essential service package and the community of practice. So it's really to make that commitment that we will move forward to support survivors of gender-based violence.
And how is Caracom related to the entire experience?
Well, as the key regional institution, it's a regional international organization that is really steeped in functional cooperation and in addressing social resilience. And so Caracom will be taking on this mantle to make sure that it will properly coordinate and supervise the different regional institutions and stakeholders in member states to ensure that we get this done. Because it's a sense of commitment that does not only come with having finances. It's finance, it's commitment, but it's really to ensure that each one will be doing their part to make sure that we get the kinds of service packages necessary for the community of practice. And so it's not only Caracom, we're looking at the OECS Commission, we're looking at SEDEMA, we're looking at all the key players in, like what Alison said, police, justice in social services, health, education, gender, and the national gender machineries, which are the bureaus regionally, will be having an important role to anchor this service package to make sure that it gets done.
Now, Ms. Drayton, in terms of the service package and the community, I mean, for the person on the ground, how will it benefit them?
Well, as I said, and I think we also heard so eloquently from your previous guest, it is when, first of all, knowledge that there are resources there to support. So many people don't report, they normalize, there's a lot of shame around it, and in many communities and countries, the way that the kind of first responders deal with it can enforce that culture of, I should say nothing. Starting in particular, usually the first responder is either a healthcare professional or a police person. And bringing everyone together, talking about this issue, talking about how can we consistently deal with it, raising their awareness so that when they go into a situation, they also probe, they let people know that there are resources there. I mean, I just came out of a meeting last week in Jamaica where we've gone to the next stage of this. The Bureau of Gender Affairs is now coordinating across nationally and getting to the community level, and it's really interesting to hear how the police, the healthcare professionals engage to say, how should I deal with it? What questions should I ask? How do I make the person feel comfortable and not threatened? And if I can just circle back to your why now, we have an enormous problem in this region. I mean, it is terrifying the amount of gender-based violence there is in this region. At all levels, we tend to think of violence as I hit you. But remember that GBV goes a non-consensual sex, early sexual initiation with someone who is not in the age group. If you look at the figures for the Caribbean, it is actually terrifying. And that was pre-pandemic. In the pandemic, what we know for sure, though we don't have the data, is there's been a huge escalation.
What we have the data for, though, for the first time, we've done 5 prevalent surveys in the region. I'm not sure if you know that. So there's Grenada, Jamaica, Guyana, Trinidad, and Suriname. And globally, 1 in 3 women have been or will be affected by gender-based violence in their lifetime. The four countries mirror that, but in Guyana, it's 1 in 2. And that tells you that we're actually dealing with a silent pandemic. And so it's never a good time, but it is very timely because the numbers are speaking for themselves now. And like Alison said, there's been an escalation during the pandemic when a lot of women and girls had to be sheltering in place with their abusers. Yes. And so because of that, we cannot turn a blind eye. It's been too long.
Now, Ms. Drayton, quickly, I mean, what is the UNFPA doing to address the issue of violence against women and girls?
Well, we, as part of our mandate, are working on achieving 3 zeros by 2030. 0 unmet need for family planning, 0 maternal deaths, and very important in the context of this, 0 harmful practices, which in the Caribbean is gender-based violence. So our programming in the region is really directed at the various elements of how you address gender-based violence. And we have been extremely fortunate that the European Union has, with its Spotlight initiative, which you probably know about, which is a global initiative, put a tremendous amount of resources into the Caribbean to help us address this. So together with other UN agencies, we've been able to build up a consistent set of programming that speaks to education, to areas to do with justice, to how do you improve health services. We're working very directly in countries such as Jamaica and Belize to support the government in building, equipping shelters or mobile health services. So it all comes together to that one aim. And I very much hope that even if, as I said, the aim is 0 harmful practices by 2030. It is a deep culture change that we need in this region, but I really am determined that we're going to get there.
Ms. Drayton, Ms. Williams, thank you so much for joining us. Unfortunately, we're out of time, but I think we're going to have you back again some other time just to get an update, of course, on the project launch. So thank you again for joining us.
Thank you.
Thanks for having us.
And that was Ms. Alison Drayton and, of course, Ms. Williams just telling us about, some of the projects that they're working on. You're on the Now Morning Show. We're going to take a break and we'll be right back. Stay with us.
But I love you. Why?